Hi everyone and welcome back to the Hair Loss Show.
Good afternoon, everyone.
Russell, good to see you again.
Thank you. You too, Vikram.
All right, so today I thought we'd take a slightly different tack. Okay, so I thought we'd talk about a topic that is, I think, very near and dear to both of us. And I do think that we both are on the same page with how we'd manage this. But I think it's an important topic to discuss. And I thought as a challenge, we'd leave it to the luck of the gods in a coin toss. And we'll make a for and against argument. Okay. And so the topic we're going to talk about is a contentious issue, which is operating on a young person, let's say a 21-year-old male that is experiencing hair loss, right? That has come to you and said, I really want to have a hair transplant procedure, right? Now, I think, I'm just going to preface this by saying I think both of us are on the page of we probably try and decline and push out that patient as far as possible. But many people wouldn't, and there's arguments.
The interesting problem is it's not usually just the patient.
Yes.
In my experience, if they're 19, 20, 21, they have a parent with them or both.
Yeah.
So, and the parent will do most of the talking to start with, and tell you how devastating this is for their child, or the young adult anyway, and how they're not socialising anymore, and they're depressed all the time, and they won't stop wearing hats. And so there's a lot of emotional pressure that comes not just from the patient to solve the issue, but from the parents. So you're really dealing with quite a complicated argument.
Right. And we've heard the discussion from both sides. So I think, but I think let's
flip the coin.
Heads or tails? We're going to go heads. Gets to go for a hair transplant. All right. Tails is against. Which would you prefer?
I'll go against. So I'll go tails.
Tails it is. Well done.
It is.
Go for it.
You mean.
All right.
So you have to start.
I'll start
because you're the heads man. So you're going to make the argument for why you would agree to operate on a 21-year-old.
I think I understand the negative aspects. I understand the potential risks of losing more hair. But as a 21-year-old male, if I'm sitting in that position, as a 21-year-old male, there's the social anxiety that is there for me that I'm experiencing when I'm losing my hair. It has caused me a tremendous amount of anxiety. It's caused me it's affecting my mood, my personality, my interactions with other people. And so I appreciate that if I'm going to have a hair transplant, the outcome that I will experience may not be permanent, because the hairline that you create may not be there forever. I may lose more hair and it may leave me with an unnatural result, but I'm willing to accept that in the short term, because right now it is my quality of life based on what I'm experiencing right now is significantly, it's impacting me in ways that you, having not lost your hair, will never understand, what it's like to be me at 21, having trouble maintaining relationships, and I feel that everyone is looking at my hair. And so there is a really sort of emotional aspect. I understand what the future potentially will hold, but, I think when I'm 30, I won't mind having to shave my head. I won't mind if I have to laser the grafts out if they look if it still looks unnatural. But I really need hair now because it's really affecting me. In terms of how I feel. I'm very worried about medication, so I may want to take medication. I may not. I'm still sort of equivocal about that. But it's purely from an emotional perspective that I would like to proceed with having a hair transplant.
Okay. So my response to that is that I have been in the field for a long time, so I have a lot of young men that feel exactly the same way as you do about it. And I never underestimate the psychological significance of what this does to your self-confidence, your self-esteem, the amount of anxiety, the antisocial aspect to it, and that your parents obviously very worried as well when they see the change in your personality and the fact that you can't seem to enjoy your life anymore. Yeah. And it is also true that if you've got significant hairline recession at 21 years of age, then there's nothing that medically we can do that's going to solve the problem for you. The only a way to get a lower hairline in this situation is to do the transplant. And the expectation that you would get a good result with the transplant is there. And we get that kind of, it's great in the first year, but then what happens later on? You haven't committed to medication, but even if you commit to medication, there's no guarantee that we're going to be able to control this. If you've got significant hair loss at 21, you're going to be harder to control the hair loss in the long term than if you came to me at 51, for example. And, operating in a panic, or making a decision in a panic, which is the temptation here, leaves you for a long time to regret it if it doesn't go to the way you expect it. So generally speaking, we would like to establish that we can get some degree of control over the process by medicating you first and saying, I'm not saying no to you, I'm saying not yet. Because what I really want you to do is to, at the moment you feel helpless because you've got no control over what's going on. If we got medication that you were willing to take and be consistent with, to think about this more carefully and make sure that emotionally you're accepting that this is now going to become a long-term fight for you, a lifelong fight for you. And this idea of what do I do in 10 years' time if it progresses, do I just shave it out? It becomes an issue. So only twice, let me explain to you, only twice in my career have I had a patient come back to me after 10 years and say, I wish I'd never done it. One was 19 and came back at 29, the other one was 20 and came back at 30. And the 20-year-old, I had 3 consultations with him over 5 or 6 months, and he twisted my arm, and eventually I agreed to it. And now 10 years later he's telling me he wished he'd never done it. He doesn't understand what his mindset was at the time. He doesn't know why he was in that crazy mindset. And he knows that it wasn't my fault because he twisted my arm to do it. But now he's got regret. So it's about the maturity of the decision making, about not making decisions in a panic. We really want to help our patients in your age group because it is devastating. It's way too early. So in summary, I think the thing is that a 21-year-old is not an absolute red flag in terms of who you're dealing with. There are mature 21-year-olds who have thought this through very carefully, have been on medication, for example, for 2 or 3 years already. They're coming to you, they've been on medication since they're 18, they're well controlled, they've thought about them as a mature decision-making process. That's a much more likely that we would proceed along that, rather than somebody who's never been on meds, who hasn't really thought about it, is just in a panic coming in and saying, I need to fix it now.
Yeah, I think, look, it's a very it's a conversation that needs to be had, and you were so eloquent with the way you talk through and really understanding. I think that's really important because no one in the history of the universe ever went, I'm really looking forward to losing my hair. So it's an emotionally fraught scenario at any point, but even more so and amplified at that young sort of age of 2021. So it's about really understanding and guiding that person through and making sure that they understand. I think saying no, one of the things I always sort of say to people is that saying no or saying not right now, it doesn't close any doors to you. It doesn't close the door tomorrow, it doesn't close the door. You can always open that door next week or next year. But if you say yes and go down that road of having surgery, that's the line in the sand. You are committing to trying to defend that hairline come hell or high water. So that's a challenge that you're going to have to sort of contend with as the potential balding area expands or the balding increases. So that's always the worry. But I thought that was very good.
And I think the thing that I want to make clear to our audience, and I'm talking to the parents here that watch the show as much as I am to talking to somebody who would be a young man in this situation, is if you go to a clinic and ask for hair transplant and all they want to say is yes, when you have for your 20-year-old or your 21-year-old, that is not an acceptable outcome. If they have not talked you through what the implications are and the benefits of being on long-term medication before you start the surgical process, if all they're trying to do is to sign you up to be on the surgical list, please go somewhere else, because that is completely inappropriate management. And I know that you are scared and concerned about your son's welfare, but just going to somebody who is willing to operate without any other discussion is not going to end well.
Yeah, absolutely. I think that's really, really important, because we're in a position where we know exactly what that patient or the parent wants to hear.
Exactly.
If you can spit it out as verbatim, and everyone is in such an emotionally fraught mind space that they'll accept it.
It's tough enough saying no to the patient without having to say no to both the parents at the same time.
Absolutely, absolutely. So I think what you've said is absolutely vital for both the patient and the parents to sort of understand, absorb, and armed with that, go into that consultation. So I think thank you for doing this, because I think it's a really important topic to discuss.
No, it's a pleasure. It is a critical topic.
Yeah. Good. Well, I hope you've enjoyed that. Hope you found that really useful. Thank you very much for watching. Please remember to like and subscribe to the channel, and we'll see you on the next episode.
Thanks, everyone.